All right. Hello, for those of you that are jumping on. Hopefully my mic's working. So if you could drop in the comments where you're watching from. I know a lot of us are probably in Florida, but I want to hear where you're coming from. So drop it in the comments. Tonight's going to be interactive. We're going to wait another minute or so as some others are going to jump on. All right. So where is everyone coming from? Cool. Sarasota. That's probably where most of us are going to be watching from tonight. Hey, Dulcie. Thanks for popping on. Okay, I'm going to give it just like one more minute or less than that, and then we're going to jump in and get started. I definitely want to make sure, I know everyone is busy, so we're going to try to get through this quick and give you lots of info. It should be roughly like 30 minutes or so. Any questions you have throughout, feel free to drop in the comments. I will get to all of them at the very end of the webinar. All righty. Okay, so let's go ahead and get started. So if you're here tonight, you probably either have been dealing with PCOS yourself, or perhaps know somebody that is dealing with PCOS, or maybe you're wondering if that could potentially be what's been going on with you. So we are going to talk tonight about how to heal PCOS naturally and to look beyond just birth control and metformin, because those tend to be the two most common solutions that the conventional medical care system typically gives women. This topic really hits home for me because I once had PCOS, and I also had endometriosis and a lot of other chronic health issues that were all really stemming from very similar root causes. But it took me a long time to truly get answers and to get on a path that helps my body actually heal. I've been down the road where I've been given birth control. They tried to prescribe me different medications. I never really took those medications because it just did not seem like the right solution for me. But I can definitely empathize with a lot of you that are dealing with PCOS right now. I know it's a frustrating road, and just know that there are other solutions out there. So I'm really excited to jump in tonight and go through lots of info for you. I hope that you learned something. And again, please, I would love this to be interactive. Toward the end, I'll definitely be able to answer any questions. So just jump into the comments section. I'll see those pop up throughout and ask your questions. All right, so let's get started. Okay, so if you have PCOS, you have probably heard some of these things. Just lose weight. We'll just put you on birth control. That's a really common one. Just take metformin. We'll talk a little bit later about why metformin is such a common kind of medication of choice for those with PCOS. A lot of times women are told that we'll just force ovulation or give you a medication to create or allow you to ovulate once you're ready to try to get pregnant. That's another common thing women are told. Or many women are actually told that their labs look normal, yet they are experiencing all of these PCOS related tendencies or symptoms. That's very common to be told as well. So what's important to know is that PCOS is truly more of a signaling issue. It's really not just a hormone problem. It's not as simple as just your hormones are off, here's how to fix it, or here's, let's put you on hormones or put you on birth control to fix it. PCOS, because it's a signaling problem coming from elsewhere, we need to uncover what's at the root cause to actually figure out how to truly heal and to restore your body. And what is also important to note is that every single female dealing with PCOS is dealing with it with different root causes. It is not the same root cause that's going to lead to PCOS for every female, which is why we always need to take a personalized approach to actually heal somebody from PCOS, and not just a blanket solution of metformin, birth control, you name it, right? So, in the next 30 minutes or so, like I said, I'm going to try to do this in 30 minutes. And then, depending on how many questions everyone has, it might go a bit longer. We're going to jump into what PCOS actually is, why your symptoms are not random, and then the 4 main root drivers behind most PCOS cases. Now, remember, most of you may fall within one of these primary causes, but there are so many others out there. These are just the 4 most common ones that I tend to see in a lot of the women that I work with in my clinic. And then we're going to talk about why conventional treatment often fails, what a true root cause plan looks like, and how to know if this approach is right for you. So, number 1, what is PCOS? So, PCOS stands for polycystic ovarian syndrome. And in the name, it's called syndrome. It is really not that's why it's so important to understand it's a cluster of symptoms. It's not the same diagnosis, does not look the same for every single person that's dealing with this. It's not just a single disease. So you can have some of these symptoms and still be dealing with PCOS. You can have all of these symptoms, or you could have none of these symptoms. And sometimes women are still diagnosed with PCOS, or their hormones and lab work may show that they are kind of dealing with a PCOS type of situation. Common ones are missing cycles or irregular cycles. Usually they're very long cycles, sometimes over 35, 40 days. Elevated testosterone is very common. Acne is common, especially cystic acne. You could have hair thinning, especially hair thinning, more like along the hairline here. That's common with PCOS. You could have facial hair start to grow. That goes hand in hand a lot of times with the higher testosterone levels. So that's why that will occur. You can see weight gain or just have a really difficult time losing weight no matter what you do. You can also see insulin resistance. Insulin resistance is probably the main one that I think people tend to associate with PCOS. However, I have seen hundreds of women with PCOS that don't have insulin resistance as well. So they don't always go hand in hand. But like I mentioned before, metformin is a lot of times that drug of choice for women with PCOS just because it's very common to have insulin resistance. Metformin can help with insulin resistance from a medical standpoint, but not every single female is dealing with insulin resistance. So it's definitely not a one size fits all approach. And then a lot of women, unfortunately, have trouble getting pregnant. So those are really common symptoms. Again, it does not include all of them, but it's important to understand that your ovaries are not the root problem. They are just responding to something else happening, typically upstream. So what we need to figure out for all of you that are experiencing PCOS or have been diagnosed with PCOS, we have to figure out, in order to heal, what is the driving factor for you. A lot of times it's more than one. It's not just one root cause. It would be a lot simpler if it was, but a lot of times it's many root causes that all are impacting your body to then lead to this signaling issue that causes PCOS. Okay, so yeah, and this is like what I already mentioned. This is where it can be so frustrating because you and your best friend could both have PCOS and your symptoms could actually look very, very similar. But the reason that you both have PCOS could be drastically different. So that's really why we need to take a very individualized approach, because there are no two people with PCOS for the same exact reason. So our method of healing has to look very individualized. And remember that PCOS is really a pattern of dysfunction. So there's many root causes. We need to understand how is your body functioning currently, and then begin to understand what is driving this pattern of dysfunction, and then start to heal from that. So what we're going to dive into are these 4 main drivers of PCOS. You may fall into one of these categories. You may fall into more than one. Maybe you feel like all 4 could be contributing to why you have hormonal imbalance and PCOS. But these, I would say, are probably the most common that I tend to see in women that I'm working with. Number 1 is insulin resistance. We talked about that. That is why metformin is known to be such a popular medication to be prescribed to women. But there are so many other ways outside of metformin and outside of that Band-Aid approach where we're just giving a medication that can actually heal your body so that we're not dealing with insulin resistance and we can take care of the PCOS. Number 2 is chronic inflammation. So chronic inflammation sounds very kind of broad and general. We're going to dive into where could inflammation actually be coming from? How can we test for this? We'll get into that tonight. Adrenal dysfunction or stress is number 3, which stress is always a contributing factor to any sort of chronic health issues. And then number 4 is thyroid dysfunction. So remember that every PCOS case has at least likely one of these, but it can look different for every single person. So insulin resistance, let's dive into first because it's the most common driver of PCOS. So it's important to understand that when insulin is elevated, this is going to cause the ovaries to actually produce more testosterone. So when your body then has higher levels of insulin leading to higher levels of testosterone, we can start to see a lot of those PCOS related symptoms, and ovulation a lot of times becomes affected and sometimes won't happen. I would say most of the time with PCOS, women are not ovulating successfully, or they're not ovulating ever, or they could ovulate 1 month and not the next, and it could be very sporadic and very inconsistent. Or they could ovulate each month and it could just be a very weak ovulation where they're still developing some sort of cyst, and then hormone levels are really imbalanced as a result of the weak ovulation. So there's, again, so many different scenarios that could be going on, but it will likely impact your ovulation, which is why it can then impact getting pregnant. You'll see inflammation increase when insulin is elevated, and then weight becomes very difficult to lose. So insulin is a fat storage hormone. So if you have elevated levels of insulin, that means your body is secreting a hormone that's going to take glucose and actually store it as fat more often, which is why we don't want high levels of insulin, especially for those people that are having a difficulty time losing weight. We need to make sure that insulin is regulated and not too high so that we can lose weight when we're trying to. And the key is that you can have insulin resistance even when glucose looks normal. So you could have your blood work done. Maybe glucose is at like 80, which is a great fasted level of glucose, but then your insulin is at 12 when you're fasted. That's still an issue. With insulin resistance, what will happen is it's almost like your body continues to increase insulin and it becomes resistant to insulin, where the cells are not recognizing it as well as they should be. So it just keeps making insulin, and then that's lowering your glucose. But the issue is that insulin continues to rise and continues to be secreted, and then we still have issues. So don't think that just because your blood sugar has been normal, looks normal, your doctor told you it's normal, that you don't have insulin resistance. We always want to look at a fasted level of insulin, fasted level of glucose, and even a fasted level of your A1C, which is that like classic diabetes marker that looks at it's really the long-term look at your blood sugar. So, another important thing to note, if you guys have done lab work before, you may already know this, but most conventional testing only checks glucose. I also find that so many times people are not even told to fast for their blood work. So if you just do blood work, like the time you're at your doctor's office and they just decide to do a quick blood draw then and there, maybe you didn't fast. So then your glucose number will be skewed. It's not really an accurate representation of what's truly going on in the body. And a lot of times they're not testing insulin. So that's important. If you're getting blood work done, always ask for insulin fasted, glucose fasted, and that A1C so we can get a full picture of what's going on there. So these are just some common signs and symptoms that you may have an insulin issue, some insulin dysregulation that likely could be driving your PCOS. Strong sugar or carb cravings. If you are somebody that like always needs a sweet treat after dinner or just throughout the day, even you're constantly craving carbs, that could be a sign. If you're having energy crashes, especially after a meal, where you feel good once you eat and then like right after a meal, you just have a really fast, quick crash. If you have extra weight around the midsection, belly weight gain that it's like stubborn, you can't get rid of it, that could be a sign. Difficulty losing weight. Skin tags. This is one I think a lot of people don't know about, but people that get skin tags often, it's actually an indicator typically of a blood sugar dysregulation issue, meaning you have an insulin problem. And then also elevated triglyceride levels. That is another thing that should be tested. It's usually part of a lipid panel, which is very general, part of your blood work. But if you haven't had labs done, that is something you should look at. So when insulin is elevated, it's going to directly push your ovaries to make more testosterone. So what we need to do is really address this metabolic signaling to actually improve your PCOS symptoms. So notice how in this case, if you are somebody with PCOS and it's an insulin related issue, we're focused a lot more on your metabolism rather than just looking at your female hormones, right? It's not all about just let's take something that can lower testosterone because testosterone's high. It's actually what's driving testosterone to be high. And if it's an insulin issue and a blood sugar dysregulation issue, let's look at your lifestyle and figure out how can we minimize these blood sugar spikes and the insulin from being secreted all day long that's actually leading to the PCOS. So here's just a little example of a lab pattern that we may see. So this is a patient, a female with PCOS who has actually been diagnosed with PCOS due to her insulin issues. And this is where you can see a lot of other markers are off too. You can see that high CRP. CRP is a general systemic inflammation marker. So remember, if insulin's high, it's typically going to also increase inflammation levels. So you may see that high on blood work, which would be CRP. The triglycerides we talked about before, that's definitely elevated. Ideally, I like to see triglycerides under 90 when you're running blood work. There's that A1C that we talked about. Now, this is a perfect example of just because your blood work markers are not flagged in red does not mean that you're in the clear. And it does not mean you're healthy. It does not mean there's not an issue. Lab values typically are only going to flag things, or labs are only going to flag things usually when they're so out of range that they then can give you a diagnosis to then be able to prescribe medication. It's all part of like the medical system and how insurance works. So if that lab value is not far out of range enough for them to say, hey, you actually have prediabetes, we can give you a diagnosis code for that, which then means that you're able to get this medication filled. If that, you don't meet all those criteria, then it doesn't get flagged. And then a lot of times your doctor may just not mention it, and they're going to say you have a clean bill of health. Yet you go home and you feel like crap. So here's the example with A1C at 5.5. And this is still higher than honestly I would like to see. I like to see it under 5.3. And that's because that research shows us once your A1C is above 5.3, it starts to impact the memory centers in your brain. That's how much blood sugar can impact brain health. So we obviously don't want to wait until it impacts our brain or our memory. We want to make sure we're always being preventative and keeping it on the lower side. So, and then insulin here, we want to keep it between 3 and 5. And you can see that this insulin above 11 is definitely on the higher side. Any questions so far? Remember, you guys can drop questions in the chat throughout this at all, anytime. I likely will just get to it at the end, or if I see it pop up, I'll answer it as we go. So number 2, remember we're diving into the 4 most common root causes of PCOS. Number 1 was insulin dysregulation. Number 2 is chronic inflammation. And it's important to know that inflammation will also increase androgen production. So when I say androgen production, your androgens are hormones like testosterone, which is the most common one people know about. DHEA is another androgen. DHT is another one. But they're all the hormones that typically are found to be elevated in PCOS. And they're usually the hormones that can lead to these unwanted symptoms like acne, hair thinning, really throw your cycle off, and mess with your ovulation. So remember that inflammation is important in some ways. So inflammation is designed to protect us when it's short term. For example, you fall and sprain an ankle, your ankle should swell up, and that's actually a protective mechanism because that's bringing blood flow to the area. It's bringing cells to actually help heal the injury. But if inflammation sticks around long term, and it's almost like that inflammation switch gets turned on for a long period of time, that's when it starts to interfere with how your hormones work, how your metabolism functions, and that becomes an issue. So it's chronic inflammation that we want to avoid. And inflammation can lead to PCOS in so many different ways. Here are some of them. But the main thing to know is that inflammation, it's not just about okay, I have inflammation. That's why I have PCOS. But we need to understand what is actually leading to the inflammation in your body. And that's where there could be so many, like an endless number of different things that could be creating it. And that's really what we focus on in our clinic is figuring out. It's almost like playing detective, listening to someone's story and figuring out, based on what you told me about this, I feel like we need to look into your gut health more. Or, based on that, past occupation you had where you were exposed to a ton of toxicity, let's dive into toxic exposure and see if you have lots of heavy metals that could be impacting your inflammation levels. So here are some of them, that are really common as to where inflammation can be coming from. Gut dysfunction. That's when you could have a yeast overgrowth. You could have parasites, bacterial imbalance, different things going on there. Food sensitivities. We don't want to just worry about those food allergies where people react anaphylactically and cannot go near a food, but the food allergies that actually create a long-term inflammatory response in the body. Those are called IgG reactions. They're super important to know about. And by testing your food allergies that are delayed, we can really decrease inflammation levels in the body. Mold exposure, especially for all those Floridians on here. Mold in Florida is so prevalent. So making sure that that's not a factor. And then blood sugar, like we talked about, chronic stress, which is always a big one, toxins. So remember that if inflammation is high from one or many of these different things, then ovulation can become a struggle. We may not be ovulating. We may not be ovulating well. And ovulation is also not just important for pregnancy. I think a lot of people get so focused on that where maybe they're done having kids or they don't want kids or just now's not the time they want kids. So they're not worried about the fact that they're not ovulating. But what's interesting is that ovulation is actually more of a key predictor of your overall health and something you should pay more attention to than even how your period is. People always focus on all the specifics around their period to determine, well, you must be healthy because your period doesn't hurt or, you don't have major symptoms, but it's actually your ovulation that is such a contributing factor to your overall health. So here's an example of a lab pattern. Somebody with PCOS that was dealing with chronic inflammation. You can see they had several food allergies. As you look at those foods, some of them are healthy foods. So it's not a matter of is it a healthy food or non-healthy food, but is somebody having an immune response reaction to it? If so, that's going to create inflammation and can disrupt hormones and so many other things. In the middle, you can see that stool test. We run a 3-day, a 1 or a 3-day comprehensive stool test to understand, is there an overgrowth in the gut? Is there yeast? Is there bacterial imbalance? All those things can also create inflammation throughout the body. And then at the very bottom, you see the mold test. So this is where we test for what's called mycotoxins, which are the toxins that are released and stored in your body when someone is exposed to mold. So mold, again, in Florida is so bad, in so many other areas too. But this is something we need to properly detox from. It gets stored in your body, the toxicity. It's not just a matter of getting out of the old home that had the molds. If you've been exposed to mold at any point in your life, so many people honestly are and don't even know about it. We need to appropriately detox your body so that that's not something that's threatening your immune system, stressing your body out, and leading to more inflammation. All right, so now we're going to dive into number 3, which is adrenal dysfunction and the stress conversation. So stress, like I said earlier, is one of the main contributing factors to all chronic health issues. And the same goes for PCOS and any other hormonal condition, especially fertility too. So what you need to know is that when your cortisol levels are high, now remember, cortisol is a hormone that honestly plays a very important role. It's what gives us drive and energy to get through the day. So it's not like we don't want cortisol to be elevated at all. It's more about when it's elevated for too long or just elevated at different parts of the day when it shouldn't be. So when we have, I would say, cortisol dysregulation, we can see ovulation become impacted. It can be delayed. It could not happen at all. DHEA is another important hormone that can start to increase. And DHEA is actually a hormone that turns into testosterone. So now we have high testosterone as well, which is pretty classic with PCOS. And then our cycle can become really disrupted. These are the women who can go like 8 months without a period, and then they get it 3 times in a row, or they get it every other month, or they get it totally sporadically and never can rely on when it's going to come. So remember that women dealing with PCOS, it's not just a hormone issue. It's rarely a hormone issue. There's other things that are throwing off your hormones to create a hormone imbalance. But what we need to do is understand, what is it that's causing that hormone balance? And if your body is stuck in survival mode, which is that like fight or flight mode, that sympathetic mode because of stress, then it's going to be very difficult to heal, very difficult to get your body ovulating and to get your hormones balanced. And then reproduction and getting pregnant definitely becomes a lot more difficult. I see that so many women that are trying to get pregnant, the main issue standing in the way is usually stress, and it's their nervous system being dysregulated. So that's an important piece to keep in mind. Easier said than done to eliminate stress. It's not about eliminating all your stress, but really coming up with solutions as to how to handle stress better and to make sure that it's not negatively impacting your physiology every day. So, a little bit more on the adrenal dysfunction. Your adrenals can also make androgens. They don't just make cortisol. So, remember earlier we talked about androgens being your hormones like testosterone, the hormones that tend to be higher when somebody has PCOS. If you have adrenal dysfunction, now your adrenals can actually start to make even more of the testosterone, more DHEA, more DHT. And that can really throw things off. So when your body's under chronic stress, the body's going to shift toward producing more of that DHEA. That's almost like a protective mechanism. Your body's like, whoa, we're just in go, go, go mode. I'm just going to like keep making this hormone to keep you going forward. And then that DHEA starts to convert into testosterone. So it's not always the ovaries. Even if the ovaries are not the primary issue, your adrenals can also create this very similar type of hormone imbalance. I said I would do this in a half hour. There's no way we're going to do it in a half hour. So we're going to go a little bit longer, but it's not too much longer. So hang in there, and remember, drop your questions. If you have questions, I'm happy to answer them on anything and everything. It doesn't have to be even super related to PCOS. If it's some other hormone related question or health related question, I'm happy to answer it. So to continue with the adrenal dysfunction, chronic cortisol elevation will increase blood sugar. So this is another way that stress can lead to PCOS, because it's not just about causing that adrenal issue that makes more hormones, but it can actually cause your blood sugar to be high. I see a lot of women in the clinic that swear to me their diet's super clean. We talk through what they're eating, and they're really not eating sugars or carbs. They're on like a very high protein, high, healthy fat diet. And it doesn't make sense as to why they have blood sugar issues. If that's the case for you, it's usually stress. It's usually stress that's leading to more cortisol production. That cortisol release is going to actually cause your body to then secrete more glucose to give your body that energy again to like survive through the stress. And that can really throw things off. So high blood sugar will lead to insulin release as well, like we talked about earlier. And then this will cause more androgens, which is like testosterone, and then can disrupt ovulation. So stress is a really big one when it comes to PCOS. And here's a quick little example of that. You could see that first hormone, DHEA, is super high through the roof. That hormone is high because the adrenals are stressed and they're making more of it. That's going to turn into more testosterone. You can see that testosterone level is very high. And this is a very high cortisol level. You should not have a cortisol at 32. Again, this is not flagged because cortisol changes all day long. So they never flag cortisol on blood work. But knowing when the person did this lab work at what time of day can give us a lot of insight as to, is this a normal level or not? And it certainly is definitely on the higher side. So to sum this up, when you're under a lot of stress, your body will produce cortisol because that's that stress hormone. When cortisol increases, it's going to lead to blood sugar increasing. When blood sugar is high and increased, then insulin has to be secreted. So now we have higher levels of insulin, which causes more androgen production, which is more of that testosterone and similar hormones, and that will disrupt ovulation. And that, when ovulation is disrupted, a lot of times is why either you're not getting pregnant if you're trying, your cycles are not regular, your cycles are not fun. Usually they're painful. Unfortunately, people get cysts around ovulation when it's not happening the way it should, all sorts of things like that. So, number 4 is thyroid dysfunction. And your thyroid is super important in regulating lots of different things like metabolism, ovulation, insulin sensitivity, and even your progesterone production. You really can't truly heal PCOS or look at any sort of female hormone condition without evaluating thyroid as well. And what we find is that most people have rarely ever had their thyroid completely tested. Many times, and tell me if I'm wrong, if any of you have had more than your TSH and T4 checked by your medical doctor, I want you to throw it in the chat because that would be awesome. That's a great medical doctor. But rarely are they actually looking at more than that. And they're usually just looking at TSH. And if it's high, they might tell you to take thyroid meds. And if it falls within that normal range and isn't flagged in red, they're not looking at anything further. So it's so much more complex than that. And when your thyroid function is low, which TSH alone is not enough to tell us if it's low, it can cause a lot of different things. It can really slow the communication down between your brain and your ovaries. It can really throw off LH and FSH signaling. These are two hormones that are produced in the brain that actually talk to your ovaries to produce hormone and to help you cycle. And it can impair your follicular development. So follicles basically develop in your ovaries all month long in order to then release an egg. So that's important. So remember, if thyroid is off, then ovulation can be off as well. These are some other things that thyroid plays a big part in. It actually is related directly to your estrogen clearance. So people with even more like endometriosis, more of what I struggled with, I had very high levels of estrogen. My body had a hard time detoxing that excess hormone. Thyroid was related to that. Gut is a big contributing factor to that as well. That's all related. Low thyroid function can cause your cells to become less responsive to insulin, which also leads to insulin resistance. This is called sex hormone binding globulin, which can lead to more testosterone. It can even throw prolactin off, which is another hormone that can suppress ovulation. So the important thing to know, because that's a lot of different mechanisms there, but important thing to know is really just that your thyroid needs to be tested completely, because if you do have low thyroid function and it goes undetected, there are so many things that it can impact. And it's going to be difficult to actually truly heal your body, especially if you're somebody dealing with PCOS without knowing what's going on with the thyroid. This is a quick little case of a lab that we tested thyroid more in depth. You can see at the bottom, those are antibody levels that were high. Only one of them flagged in red, but both are present. Both are abnormal. Both should not be high. This tells us this patient has Hashimoto's, which is an autoimmune thyroid condition that will absolutely impact PCOS and your cycles. And then you can even see, if we look into this a little bit more in depth, the T3 free and total are both very low. That's your active thyroid hormone. That's why I mentioned earlier, if you've had more than TSH and T4 tested, that's great. But rarely do people get their T3 tested, and T3 is the active thyroid hormone. That's what actually matters. That's what your cells take up. So if we're not testing that, how do we actually know if there's a thyroid issue or not? We really don't. So those are the 4 main causes of PCOS. Maybe you fall into many of those categories. Maybe one kind of resonates with you. But what I want to touch on is why most conventional treatment often fails. And let's talk about birth control first, because like I mentioned earlier, 2 of the most common treatments for women with PCOS through our medical system a lot of times is to take birth control or to go on metformin. And birth control will actually stop ovulation. That's something I think people don't realize. It totally shuts down ovulation. You really don't get a true period when you're on birth control. It's just a withdrawal bleed. It'll lower your testosterone for a bit temporarily while you're on it. And it can maybe regulate bleeding where things are actually consistent. So just because things are consistent, that bleeding, again, is not a true period, but it appears like your body is functioning better because you're starting to get into more consistent patterns, especially compared to PCOS when it's usually all over the place and irregular. But what birth control does not do is it does not correct insulin resistance. If that's the driving factor causing your PCOS, it's not going to help with that. It does not reduce inflammation, does not restore metabolic signaling. It will not heal your gut issues. It will not restore true ovulation. So remember, birth control will manage symptoms. It may help to get you out of pain, maybe stop some cysts from bursting if that's something you deal with. But at the end of the day, it's never going to address root causes. And unfortunately, only tends to make matters worse once you come off of it. And I saw that firsthand. I never had most of my hormone issues. I did have hormone issues prior to birth control, but I did not have what I had after birth control beforehand. Endometriosis, I believe, was really a result of me being on birth control. And the cyst that I had rupturing pretty much every year was after I was already on birth control. So Metformin, the other one that tends to be really popular, while it can improve insulin sensitivity and it can help to lower your blood sugar and your insulin levels, which we talked about, a group of people that have PCOS, it is insulin related. It's important to know that while metformin can help with these things, it's not going to address why the insulin resistance is actually happening. So if your diet's poor or your stress is high and that's causing it, it's not going to affect those things. It won't address what's causing inflammation. It's not going to heal any gut issues. It won't address the stress or the cortisol issues. It will not address nutrient deficiencies. If anything, it'll make those worse. And it will not directly support ovulation. So remember, birth control overrides the system. It almost makes it seem like your body's getting better because maybe symptoms go away for a bit while you're on it, but it doesn't truly heal the body. And metformin will assist that one pathway of blood sugar. That's about it. Neither are going to fully restore the body's natural hormone signaling. And with regard to pregnancy, while maybe some of you with PCOS are looking to get pregnant soon, looking to get pregnant one day, or maybe not at all, but it's important to know that it can make pregnancy harder because ovulation is what drives progesterone. Progesterone is a very important hormone for pregnancy. If you can't make progesterone, you're not going to be able to get pregnant or sustain a healthy pregnancy. And without ovulation, there's no egg, no progesterone, no implantation. So while we can use medications to force that ovulation temporarily, a lot of times those underlying issues will just kind of show up elsewhere. So they could show up in a much harder pregnancy. They could show up in, unfortunately, early losses sometimes where that pregnancy, we're not able to sustain it because that progesterone was not naturally made by the body on its own. We could see it in postpartum. I see many women navigate a very hard postpartum season when things just weren't really balanced or optimized to begin with. So remember, like I said earlier, ovulation is a signal of overall health. If you're not ovulating, that's a sign. That's a sign that there's something going on and we need to figure it out. So let's quickly dive into a little case study. This will be short, but this is a female who was when she came in to see me, dealing with PCOS, but among other things too. Migraines, anxiety, unpredictable periods, had a hard time getting pregnant initially. They gave her letrozole. This is a very common medication to actually kind of induce and force that ovulation. And she was able to get pregnant with it, which many times it can work. But again, these symptoms that she still was presenting at that time never went away because it didn't heal her body. It just kind of forced something to help her move forward and get the goal she was looking for. But she still was dealing with sleep issues, energy issues, blood pressure was high, clotting heavy periods, facial hair growth, losing hair on her head, and migraines. I showed this little Dutch test. This is just like a snippet of her test where what you can see is this one hormone pathway that's very elevated. And that is very, very common with PCOS. So this is one of my favorite tests to run for those with PCOS because we can get so much insight that we don't really get on blood work. And then after a month of running, or 1 month after running her comprehensive lab testing, including that Dutch test, along with there was blood work that we looked at too, she made lifestyle changes. She started herbs. She had more energy, less anxiety. She was able to finally start losing weight, lowered her blood pressure. And she finally went several weeks without a migraine, which was not happening for her. And then 3 months later, again, we continued to dive deeper into healing what was going on. More weight loss, no more waking up randomly at 3 a.m. She was having major sleep issues before, could not stay asleep. More stable moods, way less anxiety. Her cycle length began to get shorter because it used to be well over 40 days. She never could predict it. And the periods were no longer painful or heavy. So you can see now this is one case. Remember, the key is knowing that every single person is so different. Everybody's journey is going to look so different. The herbs that helped her may not help you. And that's why testing is so important, because your story is going to be unique. So, a root cause PCOS plan, what does it look like? We focus on really what is causing your symptoms, right? Your symptoms are just your body trying to speak to you and give you more information, but we need to figure out what's at the root. Things we can look at: metabolic markers, insulin patterns, your thyroid in depth, your sex hormones, which is like your estrogen, progesterone, testosterone, all those hormones and their patterns. The Dutch test shows us more insight into those hormones. Your cortisol rhythm, because we talked a lot about how stress impacts PCOS. We'll look at nutrient deficiencies. We look at inflammation markers, your gut health, environmental exposures like toxicity, heavy metals, mold, all of that. Because PCOS is just a signal, right? It's not the full diagnosis. It's not the full story. There's always other things contributing to it. So here are, just to show you, these are only a few of the many, many tests we can run. The key is understanding and like unlocking the missing pieces to your story. Do we need to start with hormones? Do we need to start with mold testing? Do we need to look at your liver, how your liver is functioning first? Maybe we just have to lower inflammation first. It's all about understanding what's at the root, starting at really the foundation too, and then going from there. And then we uncover layer by layer to help your body heal and to function better. So this is just the quick, like, step-by-step process of kind of how we approach things with PCOS and really with any other health condition. It's not just for PCOS, but it's always about identifying roadblocks first, removing the disruptors, removing the stress from the body. Remember that your body is designed to heal and function optimally. We are all put on this earth. God designed our bodies intentionally, and we are designed to function well. When your body's not functioning well, it's because there are outside stressors impacting it. And I think that's the key. Our medical system is all about looking at a body that, your body's doing something wrong, or we need to give you this to stop this from happening. When your body has symptoms, it's telling you something. It's telling you a story. We just need to reflect and figure out, like, what is it trying to tell us? What stress is on my body that's preventing it from healing and from functioning the way it's supposed to? And that's when we can then restore signaling, restore normal function, and restore normal physiology so that symptoms go away. So if you don't already know us, this is my amazing team. We're in Sarasota, Florida. That's my husband and I in the middle. To the right of me is Dr. Jennifer. And then to the left of Dr. Connor is Dr. Kylie. We are the 4 chiropractors at our clinic. And as chiropractors, we believe that the body is designed to heal and function as optimal as possible. It's stressors that get in the way. That's really the foundation of what the chiropractic philosophy is. And because of our philosophy on how the body works, we are able to kind of expand that and dive into so many other things to help women, or really everyone, to heal. But we are super passionate about helping women heal from PCOS and any other related female thyroid hormonal struggles, to help women to live life to the fullest and to live a life without pain and without symptoms. So because you all attended tonight and stayed till the very end, we have a special offer. So if you are somebody that has been cycling on and off birth control, maybe you've been told to just lose weight, maybe you have been trying to conceive, you just feel stuck, you're not getting, the results you're expecting, remember that there are answers. There is never no hope, but what you need is a different perspective, and we need to understand what is driving your PCOS, what's causing it. So you can spend the next 6 months either managing symptoms with typical conventional approaches, or we can spend the next 6 months actually restoring physiology and helping your body to heal the way it was designed to. So here we have, for those still on the webinar tonight, a really special deal that we never do. This is for tonight only, and it's going to actually end. So it's tonight, tomorrow, you have the option into Thursday. It's for 48 hours only. When you book an appointment for your new patient evaluation, which either if you're in person, you can do it in person, you can do it virtually as well. We work with women all over the United States. It's only $99 for that initial appointment. And what we're going to do, because you watched this webinar, we already educated you a bunch on what you're getting yourself into. We're actually going to give you $100 back. So essentially, you're getting $100 credit. We're going to pay toward your lab testing. Lab testing is usually a few $100s. So expect to pay money for in-depth labs. It's going to cost you some money. It's not through insurance, because insurance is only going to cover what they deem necessary. When we're working to heal your body instead of just medicate your body and suppress symptoms, you need to run labs more in depth to give us true answers as to what's driving your symptoms. So keep that in mind. But this, again, is for 48 hours. It's going to end Thursday at 7 p.m. So what you can do if you're interested is either scan the virtual QR code or scan the in-person QR code and find a time that works with you, and work with either I, Dr. Jennifer, Dr. Kylie, who are all trained the same way to help you with this approach to really get to the root cause, understand what's driving your PCOS, understand what's driving any of the symptoms that you're dealing with, and to truly heal your body. So if anybody has questions, I'm going to leave this up, and I would love to answer any questions that come up. No question is a dumb question. It can be about your personal case. It can be something you've heard. It can be something that, you've just always wondered about. Whatever it is, go ahead and drop it in the comments. I'm going to hang around for another couple minutes, and I will answer anything that comes through. So thank you all so much for tuning in. I hope it was helpful. If you learned something, drop that in the comments. Let me know if any of this was new information for you. I do hope that if you are somebody struggling with PCOS or anything similar, that you at least leave tonight feeling hopeful that there is a solution. PCOS is not something you're stuck with. Whatever your symptoms are, it's not something you're stuck with. There's always a way out, because your body's designed to heal. So thank you all so much for joining. If there's no questions, we will just finish up. So let's see, I'll give you another minute. Awesome, Monica. Thanks for sharing. Have I worked with any cases with healthy lifestyles and low stress, but still unable to lower testosterone? Oh, I love that. Yeah, I mean, so now I would say stress is a very general term. I ask women all the time, what are your stress levels like? And I think when we hear stress, we always automatically go to mental stress, thinking that, oh, I love my life. I'm not stressed, and, life is good. Things are easy. That's one component. So what I will say is, a lot of times there's another stressor that we're missing. While it may not be mental stress that's playing a part, it could be something else. I see women many times that live a super healthy lifestyle. They eat everything, eat as clean as possible. But usually there's something deeper. So when we talk about stress, it could be that there is like a toxicity that they're being exposed to they don't even know about. That could be a stressor causing low testosterone or causing some imbalance. So Fiona, I would just urge you to look a little bit deeper to figure out like what else could be contributing to that stress, because stress, again, is just very general. It's not just mental stress that we want to think about. Let's see. Okay. So this is a great question. If you stop taking birth control in January, do you need to wait to have blood work done? I usually say 3 months. So that gives your body enough time to kind of detox from the birth control. And at that point, I see a mix of what happens. Some women get off birth control, their period comes back right away, and it seems like they're cycling. And then we wait for about 3 periods just to regulate, let things, kind of go back to like what their normal is, and then we test. I also see, which I would say is more common, that women get off birth control, about 3 months go by and they don't get a period. And this is super, super common. We have a birth control webinar coming up in April, actually, which you should tune into. But then I would definitely test. I wouldn't wait any longer. We don't want to just wait around and waste time for the hormones to just come back and get your period. We should definitely test. So if you said you stopped in January, now we're almost at April. Now is a great time to test. There's definitely been enough time where that birth control should be out of your system. And then we usually help women to navigate that journey coming off birth control and optimizing again. Birth control will actually deplete your B vitamins. So usually we're working on upping our nutrient levels, bringing in B vitamins to replenish anything that was depleted. And then we also will help your liver to detox better to make sure that is totally out of the system and we can kind of start clean. So, good questions. Anything else? You're welcome. All right, guys. Well, if that's all, then I hope you all have a wonderful night and get back to doing whatever you're doing. You can always reach out. You could give our clinic a follow, give my personal Instagram a follow, as well as YouTube. I'm always sharing information about fertility, hormone imbalances, and our clinic as a whole sees not just women, but people in general dealing with any sort of chronic health issue that you're looking for answers for from a root cause perspective. And we work with patients all over the United States, even internationally, depending on the country. But thank you again so much for coming. Reach out if you have any follow-up questions. I'd be happy to answer them. We always offer initial free calls if you just want to learn more, see if this is the right approach for you, or get more details before you get started. So have a good night, everyone. Thanks again. Bye.